Hi, everyone. Welcome to our Facebook Live. Nak now, Virginia Hedrick, Shregon Mewa Mechuk. I know it's been months since we've done a COVID-19 live, and I'm really, really honored to be joined by Dr. Kashal today. And I will turn to you, Dr. Kashal, for introductions.
Hi, I'm Dr. Kaushal. I am a pediatrician and I'm the Deputy Medical Director at the Fresno American Indian Health Project. Thank you for giving me this opportunity to talk to the community about COVID-19.
First, I wanted to just hear from you about what has been your experience as a pediatrician with COVID-19 and children.
So now this has been ongoing for, I would say, over 2 years now. Yeah, we're in May. And with the very first train, when everybody was sheltering in place, and we were not seeing that many children getting affected. The schools were closed. People was just not limiting the contact with the outside world. Kids were mostly home. We weren't seeing children getting as affected. But then I think as variants kept emerging and there was what we call the pandemic fatigue started setting in, and people just wanted to go out and do things and start living normally again. We started seeing more and more number of kids that started having more symptoms, and this was around Delta. And then post Delta with Omicron is when we saw the most number of children getting affected. So that was my specific experience with kids.
One of the things that I think about, like, I was really eager to get my kids vaccinated and definitely looked at the trial data related to children in the studies. And we were, got vaccinated just as soon as we could. I have kids ages, adults, and then 12, 10, 8 and 5. So sort of in that range. So I had my 12-year-old did get the 12 plus, the adult vaccine. And then can you tell me like what is different about the vaccine for 5 to 11? Is it the same as what we get as adults?
No, so firstly, the dose is only one third in the 5 to 11 age group. The vaccine, firstly, only the Pfizer vaccine has been approved to be given in the 5 to 11 age group, and not the Moderna, not the Janssen. No other vaccine has been approved in the 5 to 11 age group. And the dose that you give to this age group in the 5 to 11 age group is 10 micrograms versus the 12 and up age group that is 30 micrograms. So it's one third the dose. And this is not just a random number that they decided that, oh, 5 to 11, let's just give the 10 micrograms. So there is a process and logic behind deciding the amount of vaccine dose that a particular individual is supposed to receive. So basically what they do is that in the trials, they try to inject the mRNA in during the trials into the person and see that what is the minimum dose that is injected into a person that can evoke an antibody response, that what the immune system is able to identify as and create a robust antibody response so as to counter the real COVID infection. So what they found was that the 10 microgram dose was enough in that 5 to 11 age group to incite that antibody response that would counter the COVID-19 virus when it actually hits a child in that age group.
Thank you so much for explaining that. Because I think there has been so much research that has happened really at such an accelerated rate, that it's really important to know that it wasn't random, and how they sort of chose sort of the minimum dose necessary to get the effect that we want a vaccine to get. Have boosters been recommended for 5 to 11-year-olds?
Not for that age group yet. unless you are severely immunocompromised, and that too, the physician has to seek appropriate approval. And basically, it's a very strict process if you want to give a booster to the 5 to 11 year age group. But the booster has been approved for the 12 to 17 ages. But
young children too, just as a mother, what that decision has been like for you to get your children vaccinated. And I think you have one that's younger and not eligible for the vaccine. So
yes.
what's that like for you as a parent?
So it's been an interesting 2 years, over 2 years now. And actually, we are a double physician household, and my husband was actively working in the COVID ward when the pandemic hit. So we had the whole routine of what you like have been reading about physician and healthcare workers, doing the garage baths and like having a separate isolation room. So we did all of that with my husband actively seeing COVID patients. And actually, my younger one was only 3 months old when all of this started. So we had to be, he basically had no, he had just had like one set of shots, uh, the ones that you get at 2 months of age. And really, that was it. That was the immunity. And there was no vaccine at the time, and he was at high risk. So we have somehow, but to our knowledge, we have not had COVID in the household by being crazy, crazy cautious with like masking and vaccinations and just like social distancing and being more careful when the surge has happened. And my husband, like, just doing all the uh, going the extra, taking the extra steps to be careful to protect our young kids. But yeah, my younger one, he's still not eligible. Now he's about 2 years and 3 months old. But he's still not eligible for a vaccine. But my 5 year old, he received the vaccine as soon as it was out in December of 2021. And of course, my husband and I, we have received the vaccine as soon as it came out for healthcare workers in 2020, and we've been boosted too. My older one does go to school, so he, you get it. You have a 5 year old, so we are at risk of he, because of him, and now because of my job and like what my husband does. But so far, it's been okay. Everybody has been vaccinated at home, except for the younger one. And I'm just waiting and waiting for the FDA to approve it for him. And we're a small family, uh, extended family, or whoever we have been meeting, they're all vaccinated. So that has helped protect the youngest family member in our case. So that's been my experience.
I get asked a lot, like, um, is this something that we should still be worrying about? Like, isn't COVID pretty much gone? And aren't these new variants? I know you spoke about variants earlier. Aren't they just getting weaker and weaker? And isn't this just the common cold? And so I'm wondering if you can respond to that. Is COVID-19 just the common cold now? Should we still be talking about COVID-19 vaccines? Is this kind of going away? Because it feels like for some, as things are opening, and we've returned to whatever normal is. I feel like everyone has to recognize that history is like happening every moment, and like normal is ever changing, right? Like 25 years ago wouldn't be the same normal we're experiencing now. So given all of those parameters, what's your feeling on like where we're at with COVID-19?
So my it so yes, the strain has weakened. There's no arguing that. But what I'm also seeing is it's one thing to just talk about what is happening in the United States. And yes, in the United States, the strain has weakened. There are less people who are being rushed to the hospital as of now. Things are at a steady state, similar to, and it kind of gives me a feeling of where we were like last summer. We were pretty much in the same phase. Like I gauge the severity of the strain, yes, of course, I follow the numbers, but I also am able to gauge a little bit from how many sick patients are getting admitted on my husband's service at the hospital. So that's another way for me to gauge how bad COVID is. So right now things are quiet, and the testing is, everybody has access to tests, and even if you are getting positive, most patients are not getting as sick. We do have the access to Paxlovid, which is it's a good drug to help people who are at risk of developing severe disease. But to say that it is just a common cold, I think that would be stretching it a bit too far, because we don't know what are the long term effects of this, getting this infection now, what effect that will have in 5 to 10 years. There have been studies that this particular virus does cause uh, you know there are certain bad effects on the brain and the lungs. Some people report like that they're just more tired, like not just a week out of COVID, but for months and months and months, and they said feel like there's like a brain fog. So basically, the effects of the virus are very unpredictable. So that is why I won't just say that, hey, this is just a common cold and we don't need to do anything about it, or we don't need to be worried about it. My take on this is use the tools that we have to protect against the bad effects of COVID, which may happen in case you don't use the tools. And some of the good tools that we do have right now is access to masking and access to vaccinations.
Think that you're absolutely right. We have a lot of tools. And, I also wanted to highlight something that you shared earlier about your youngest, your 2-year-old, is that we can create safe bubbles for our young ones. So in our family, we do have a grandbaby and she's almost 6 months. So she's a
Oh,
long ways
yes.
from being eligible for a vaccine. Without any new vaccine approvals. And so, but you can create safe bubbles, right? Like
Yes.
parents and family. And I hope that some of the things that we take away from having lived through this pandemic is that we think about sickness and we think about how we care for our communities differently. So it's really common for me to say, you know what, someone's in my household isn't feeling well. You might not want to come over because I don't think it's COVID,
Mm,
but we're having a stomach bug, which really happened just a few
yes.
weeks ago, right? So I told
Yes.
my mother-in-law and family, like, there's something going through my house. I wouldn't want to get anybody sick. And so
Yeah.
like the level of comfort that we have as a community and sharing, hey, I'm sick and I don't want
Yes.
to get you sick, is something that we should
Yes.
have been doing. And we used to practice,
Yes.
right? Like hundreds of years ago, like in pre-contact communities, we had forms of isolation and quarantine when people were sick. There was a deeper care for neighbor
Yes.
community than we
Yes.
somehow experience today, right? So that's like one of the ways. And I just wanted to like zero in on that because you shared that. I wanted to share that too, that we can protect those who are not vaccinated. And we also know in people who are severely immunocompromised,
Yes.
vaccine is not working as hard. It cannot do its
Yes.
job to the fullest extent. So even people who are doing everything they can, they're still at risk for experiencing severe COVID because their immune systems are weak. And that is true for folks with diabetes and other conditions that you mentioned earlier. So I just wanted to highlight that care for community and the things that we can do, even for those who aren't vaccinated. There's this new word that we've been hearing about, endemic. So can you talk
Mhm.
about what does it mean for a virus to be endemic, and what does it mean to be in a pandemic?
Okay. So endemic is something that belongs to a particular people or a country. And a pandemic is a disease or a condition that's spread over multiple countries or continents. So to give you an example, the seasonal flu or influenza would be an example of an endemic virus. So endemic is where you are seeing consistently low numbers. The healthcare system is able to manage a condition and people are all able to get the care that they need. Now, people ask me, oh, has the COVID-19, has it become endemic already? And I think that's too soon to say, because without knowing if there is another variant on the horizon, or without knowing, so far, there hasn't been really a predictable pattern of the disease. So the disease happened, it flooded our hospitals. There was no PPE. There was people were wearing garbage bags in hospitals as PPE. And then we thought, oh well, this is a disease only of the winter. And then summer came, the numbers were still bad. And then around like early fall, we were not anticipating. Delta came around, and then Omicron happened. And then basically uh, there were still cases that even though things had kind of settled down in America, but you and I both, I mean, and I'm sure other people are too. Everybody's on social media today. If we're following global health news right now, we know what the condition is right now in China. Like this has been the worst uh, phase of the pandemic as far as China is concerned. So I wouldn't yet call a disease endemic yet without knowing where we are headed, unless I see a few predictable trends or patterns of the disease. And right now, there hasn't been any predictability. Like, can you or can any epidemiologist with all confidence say, then that's it? Like, we're not going to have another variant? I don't think so. So, unless we have that guarantee, we cannot call a disease an endemic disease. So it will take a couple more seasons of no more new variants, nothing new emerging, no new hospitals getting burdened and people out on gurneys and crisis wards being set out outside the hospital to call a disease that, okay, now, oh, well, now it's endemic. So that's my 2 cents on that.
Oh, I wanted to ask you about risk factors. So, just
Mhm.
to have a balanced conversation about vaccines, are there risk factors related to, children and adults too, but are there risk factors related to children getting the COVID-19 vaccine, side effects and or long-term effects that you're aware of?
Okay, so what we're aware of is that as soon as you get the COVID vaccine, you can have like the side effects that we see, the immediate side effects that we do see are there can be like a mild low grade fever, there can be some chills in some cases, there can be some fatigue or some pain at the injection site. But these are side effects that you can get with other vaccines too, and these are just not specific to COVID-19. But it's important to remember that these are effects, and these effects are a sign that show that your immune system is actually responding to that protein that got injected in you and is priming the immune system to act appropriately when the real COVID-19 hits your body. So these are the side effects that I've seen. Of course, my 5-year-old actually did not experience any of these effects. I planned it all. I did it all on a weekend. I took him for a shot on Friday, and I was like, okay, whatever it's gonna be, the fever, fatigue. So what? One weekend is ruined. He can deal with it. I can deal with it. But by God's grace, thankfully, he did okay with the first shot. He did okay, and then with the second shot, I was worried. I was like, oh, maybe it'll be the second shot, because a lot of people are getting it with the second shot, these kind of side effects. And thankfully, he did okay with even that. So now we'll see if and when the vaccine comes for, when I can get my 2-year-old vaccinated. We'll see how he does. But yeah. And yes, and there has been, word some patients have been asking me about the myocarditis, if that's what you were alluding to, the inflammation of the heart muscle. So myocarditis is inflammation of the heart muscle, and pericarditis is called is inflammation of the outer lining of the heart. And some children and teens who got the Pfizer vaccine, there were rare cases that were reported, and most cases were seen in the age group of 12 to 39 years. But they were very, very, very rare, and more and more, then they did more and more studies on it, and they found out that if the dosing interval between between the two vaccines gets spaced out more, they were not seeing that effect anymore. So that's another thing to remember, that usually the recommendation between the Pfizer vaccine, the first and second dose, is 3 weeks, and between Moderna, the first and second dose, 28 days. But if you space it out farther, then even that risk disappears. So, and the other thing is that COVID-19 by itself can cause these side effects. So that's the other thing to remember, that the myocarditis and the pericarditis can also happen if you get the real COVID-19. And that myocarditis and pericarditis that you will get in the event that you get the real infection is much more severe than the one you would get if you get the myocarditis or pericarditis from the COVID vaccine. That myocarditis and pericarditis that you potentially get from the real COVID infection is the one that's more likely to get you admitted in the hospital and will require more intensive monitoring versus the myo and pericarditis that you would get with the COVID-19 vaccine. And that can be just treated with like a simple ibuprofen and like a consult to the heart doctor just to make sure, if at all, uh, to make sure that everything is okay. So that's that.
Thank you. Thank you so much. And I don't want to ask it because I feel like sometimes when we ask questions, it like reintroduces this, but I'm just going to ask it anyways for the sake of it's a question that comes in often, and it's really generally about vaccines. And so I think I can ask this question about the COVID-19 vaccine and other childhood vaccines. Is there a link between being vaccinated, immunized against COVID-19 or other vaccines, and autism?
Okay. How much time do you have? Do you have a day? Do you have 24 hours? Okay. Long story. Okay. So I can talk about this for days and days altogether. So do you want the short answer or do you want a longer answer?
Short answer is
Short
fine.
answer, and the answer is that intensive several studies have been done on several populations over the years since this rumor first emerged, and all of that has been discredited, and there has been found no evidence that vaccines cause autism. And the person who had started this rumor actually got his medical license revoked because it was completely on a bogus claim that he just put out there to you know, after colluding with some lawyers who were trying to get money from vaccine companies. So it was, so that's the shortest that I can give you.
No,
But
thank you. I
they
appreciate that.
don't.
And I think you highlighted something that we've been sort of battling this entire pandemic, which is just unfounded misinformation. It seems like somebody can just put something out on the internet, like put out, like there was things put out that the COVID-19 vaccine causes infertility, founded in it completely baseless. So when something is baseless, that means there's no facts to support it. It's just someone saying something. And we live in a time of like viral memes and viral social media. And so, I think I just appreciate you highlighting like the source of that information, like check the source.
Yes.
Really, if you're
Yes.
concerned about something, check the source. Is it valid? Is it well
Yes.
researched? Does the person really have credentials? What's the general like medical community saying about something? Because one really poorly done research, no one would even call it research, linking vaccines to autism was not scientific, wasn't founded research, now has been lasting decades and caused
Yes.
harm. It's caused harm. We have children now who are getting measles. We have diseases and conditions that are now present in the United States where we had fully eradicated them. And so I just thank you so much. I know we both sort of laughed at like, oh, we have to answer this question, but it's important just to
No,
think
it's important.
about.
I laughed because I can talk about it all day, and I feel like I did not laugh because I just wasn't sure how much time you have. That's why I laughed.
Yeah, no, thank you.
But no, I'm happy to address all questions, and it's just unfortunate that one or two callous rumors or just statements that someone might put out, how much fear and damage, how much fear that can create, and how much damage it can cause in like just one small statement. So I think that's what this particular statement did, and the damage has still not been undone, unfortunately.
Yep. Well, I want to say thank you. In my language, we say walk thou. So thank you so much. I know that setting aside time on your Sunday afternoon was definitely a lot to ask. And I know that I borrowed your time from your children. And so thank them and your family as well for spending time with me. I really enjoyed this
Thank
conversation.
you.
And I want to thank folks who joined us on the live. I've seen different names pop across my screen. One you might recognize, Makella Jones says, "You are worthy, Dr. K."
Oh, thank you. So are you. We are all worthy. You are all worthy. Thank
So,
you.
yes,
Thank you.
thank you so much. Walk
Thank you for taking the time to listen and to educate yourself. And I'm available should you have any questions. I'm here.